Welcome to Clinician's Notebook by Doc Athena. This is a Country Vet's Technical Diary to anyone for free.
What is FLUTD?
Now let's proceed to case presentation.
FLUTD is a complicated case being a collection of different conditions that could be associated with different causes.
Today, we are going to discuss case number 002, FLUTD or feline lower urinary tract disease in cats.
Patient's Notebook Case Number 002, FLUTD in Siamese cat. A case of feline lower urinary tract disease in a 1 year and 5-month-old intact male Siamese cat. Clinical report, case presentation. On August 3, 2010, patient 002, a 1 year and 5-month-old male Siamese intact cat, was presented to the hospital with a chief complaint of dysuria. For the subjective part of our medical record, here is the history. 1 week before a patient was presented to the hospital, owners observed the following. The patient tried to urinate, but little to no urine was released, medically called as stranguria. The patient often licked his penis, and the owners gave amoxicillin, and his urination slightly improved, but appetite declined and defecation was abnormal, having black and dry feces. Patient's diet was whiskas in can, fed twice a day. For the objective part of our medical record, during the presentation, clinical examination revealed body temperature was 38.2 degrees Celsius, having slight hypothermia. Patient weighed 3.4 kilograms with a body condition score of 5/9, which is ideal. However, there was a delayed CRT of 3 to 4 seconds. Also, there was a pale mucous membranes. And during the physical examination, most findings were normal except for dirty ears with alopecia behind the right ear. CBC also revealed lymphopenia. At that time, treatment was cystocentesis. We administered 40 ml of normal saline solution subcutaneously, and the patient was prescribed with multivitamins and mineral supplement, bisacodil, pineapple juice diluted with water, and antibiotics cotrimoxazole. The owners were advised to return the patient on August 17, 2010 for follow-up. On September 16, 2010, the patient was presented again to the hospital, and this is already the second presentation with the same case. So immediate history back then was August 8 to 13, the patient was given amoxicillin, and note that the owners did not follow the prescription. On September 14, dysuria was observed again. And on September 15, the night before they brought the patient back to the hospital, they observed vomiting. And that's the only time that they give cotrimoxazole. On September 16, the patient was clinically examined again, and the patient weighed 3.5 kilograms. Body temperature was 39 degrees Celsius with a heart rate of 188 beats per minute and respiratory rate of 24 breaths per minute. During the physical examination, significant findings involved slightly dry mucous membranes and enlarged and full urinary bladder upon palpation. Laboratory tests were requested by the attending veterinarian, and the results were as follows. There was a marked leukocytosis with 34,700 cells per microliter total white blood cells with neutrophilia and eosinophilia. The PCV or hematocrit and platelet normal, However, for blood chem, there was a low creatinine. Of course, urinalysis was also conducted, and there was an increased protein with white blood cells and red blood cells in the urine sample. Radiographic examination was also performed, and findings showed the absence of uroliths in the urinary bladder, which is technically called as cystoliths, and urethra, which is technically called as urethroliths, on lateral view. However, ventrodorsal view showed deviated urinary bladder. For differential diagnosis at the time, the list includes urinary tract infection or UTI, urinary obstruction, urolithiasis, and FLUTD or the feline lower urinary tract disease. With that in mind, the attending veterinarian suggested to have surgical treatment, which the owners agreed to. So, exploratory laparotomy was done. The photo here presents the clipped surgical area showing the enlarged urinary bladder. The patient was placed on dorsal recumbency. The skin incision was made and it was extended using Mayo scissors since exploratory laparotomy was being performed. Here, the enlarged urinary bladder was exteriorized. The photo shows the collected hematuria by manual aspiration using a syringe. For post-op prescription, patient was prescribed with marbofloxacin and dexamethasone. Catheter was also placed correctly and left overnight for close monitoring and manual aspiration of urine by suction. Another dose of dexamethasone was given 15 hours after the last shot. The following day, the owners were referred to another hospital for confinement. For follow-up, patient was confined to another hospital from September 18 to 20, 2010, and by phone call, unfortunately, according to the owner, the patient died on September 20, 2010. For references for this particular clinical case presented in 2010, I would like to thank the following: Balbino PBZ, Viana JA, Bevilacqua PD, Silva PSA, Dijekran EV, LAR PV, and Hovers PJ, Egestudier AV, Lund HS, Transvite R, and Sodom H, Forrester SD, Gunmore DA, Nilsson JC, Plum TC, Rosal MIC, Tilly LP and Smith FWK, and Thornton K. Thank you very much. So that's it for our clinical discussion for Clinician's Notebook Case Number 002, FLUTD in Siamese Cat. I hope you learned something from this video, and I hope to see you again in our next lecture. Thank you for listening to Clinician's Notebook by Doc Athena. That's it for now. Please take care, everyone. God bless us all. See you again soon. Bye!
That's all, folks, for our clinical discussion from Clinician's Notebook by Doc Athena. I hope to see you again in our next lecture. For those who have not subscribed yet in our YouTube channel, please do so. And if you have any questions, please leave them in the comment below, or if you want a private conversation, you can send us a message to Doc Athena Facebook page. Please keep safe, everyone. God bless us all. Bye!